our Ebenezer Trust. Essentially, we'll be going through these trainings for the next 5 days until Saturday. It will be 1 hour training day. The hope is that half of the times, one of us will give a lecture, and then the other half will then have a discussion. So essentially for tonight, I will be doing the presentation, and the outline of my presentation, I'm going to briefly with you the objectives of this training, not just tonight, but the entire 5 days. Why do it's necessary to have this training? We will define what exactly COVID-19 is, share a bit of signs and symptoms. How can we identify that somebody has got COVID-19 infection? We will also discuss the situational analysis in terms of share what is happening in Zimbabwe, in the region, and globally. So essentially that will be my presentation tonight. And then in terms of the objectives for the training, so in these 5 days, in these 5 hours that we're going to be together, what are we hoping to achieve? We hope as a medical team that by the end of the 5 days, we will have an appreciation of what's going on in terms of globally and locally in terms of COVID-19, and also what are some of the drivers of infection, what are the challenges that we are facing as a nation in terms of responding to this pandemic. We also hope that at the end of the 5 days, we'll be able to, we would have had time to discuss the various strategies that are available to us as individuals, that are available to us as families, as communities, to stop the infection from one person to the other. We also want to discuss the principles of managing infection. So essentially, when somebody gets infected with COVID-19, how are they supposed to be managed? Whether it's mild, whether it's moderate, whether it's severe, how do they get managed in this country, in this city, across our nation, and where do they seek management, and how are they supposed to progress after kuti vanoita sei kana vaziva kuti vane infection. Also, we'll discuss the whole issues around quarantine and isolation of patients with mild or moderate or severe illness. We also realize that a lot of us are going through psychological trauma because of COVID-19. I think the basic truth is that COVID-19 has changed our life. No life has not been impacted with COVID-19, and there are a lot of psychological issues that are going through. I think of how has their psychology been impacted? I think of a breadwinner who is no longer able to go to work. I think of a mother who's got a child and a COVID-19 and they don't know whether they're going to make it or not. So we also hope that during these trainings, we'll have time to discuss the psychological impact of COVID-19 and how we can provide support to each other. How can we provide support to our church members, to our cell group members, to our family? And then finally, we hope that we'll be able to discuss principles around environmental cleaning. So in a situation where one is confirmed to have COVID-19, how do we then sanitize, whether it's a household setting, whether it's a church setting, whether it's a work setting. So essentially these are objectives for our training. Muchiri kundinzwa here?
Tikukunzwai.
Wonderful. Skamanzwisisa zvatoda kuita svondo rino handiti. So by the end of the week, we hope to have discussed these issues. So what exactly is COVID-19? The reason I was hoping that Dr. Yeo was going to give opening remarks, but the reason that most of us were asked to attend this training is because we have been identified as key people in our various assemblies. And as key people in our various assemblies, we hope that you are going to help us respond to COVID cases, to COVID situations in our communities and in our churches. So we are trusting that this training will go a long way in equipping us to be able to respond to some of the challenges of COVID-19. So we'll try and be as basic as we can, But in the discussion, you can ask anything about COVID-19. I'm not the only one who's going to be answering questions. Various team members from the FM medical team are present, and we will be discussing. So don't worry that I'm going basic. When we come to the discussions, I want us to be free and to ask as many questions as we want, and it doesn't matter the depth of the question. So COVID essentially means coronavirus disease. The co is for coronavirus, the D is for disease, and 19, this is a disease that was essentially named in 2019. We all know the history from Wuhan in China. And so this is the disease, but the causative agent, chinokozera urwere hweCOVID-19 virus. And virus iroro SARS-CoV-2. SARS essentially just means severe acute respiratory syndrome, coronavirus 2. So before SARS-CoV-2, we know kunema coronavirus akawanda angagara achitozikanwa. So coronaviruses have been known to cause respiratory symptoms. But this one is called a novel coronavirus, i.e., if virus richangobva kunamewa or if virus richangobva kuidentifywa. That's where the whole issue of novel comes in. So the causative, so SARS-CoV-2, severe acute respiratory syndrome, coronavirus 2, no virus rinokozera urwere unonzi COVID-19. So I hope I clarify that simple fact. COVID-19 is the disease caused by SARS-CoV-2. And this, I think, since the end of World War II, I don't think the world has faced a bigger challenge than COVID-19 pandemic. So it's really a defining moment in our global health. It's a defining moment in global health crisis, and it has presented one of the greatest challenges humanity has faced since World War II. So that is what COVID-19 is. So coronavirus, severe acute respiratory syndrome virus CoV-2 causes the disease COVID-19. So when we suspect that somebody has COVID-19, I think I should have, when we have got symptoms which we'll discuss that make you suspect une COVID-19 disease, what are you supposed to do? The simple message is we can only suspect that you have got COVID-19 disease, but we can only definitely say utori nayo kana watestwa. And the test that we want is, so kunema test mairi ari kuitwa. So there is the PCR test, kana makamunzwa inzi PCR test, PTR test, kozoita iri kunzi rapid test. So I want us to be very clear pama test mairi aya. The PCR test, ndoya unaenda ku Wilkins kana ku Lancet, I'm talking in Harare, but across the nation, kune vanhu ve rapid response team ve Ministry of Health, kana kuzvipatara zve Ministry of Health, vanhu kwavari kundotestwa PCR. Ndopa unoiswa a swab in your nose, that then just swabs in the inner aspect of your nose. Those that have gone through the testing, it's uncomfortable. This test inonzi PCR inotibatsira kundotsvaga the virus itself. So test ye PCR ikadzoka iri positive. What it means is it confirms that you have the infection. So PCR testing, this is no test yatiri kurecommenda vanhu. Even world over, this is the test that is recommended for diagnosis ye COVID-19 infection. But what's happening manje munyika muno ndekuti PCR testing iri kudhura. So in the public sector kurumende, you can get this for free, but dzimweni dzenguva kunowandirwa. So sometimes people vakuenda ku private kunana Lancet, I know mamwe labs akutangawo, but ikoko test yo iri kuti dhure, I know Lancet it's about $65 per test. So they are now ending up doing the other test, the rapid test. A rapid test, it's just a simple blood test. My results are buda ipapo. But The challenge here, rapid test, which I want us to underline, is rapid test, it's not a very good test. Scientifically, it is not recommended. Haitarisiri kuti ishandiswe for diagnosis yekuti tinyasoziva kuti une test here, because kakawanda pekuti the test inouya iri negative yet iwewe une infection. So the test can actually miss infection iripo kudhara, or the test inouya iri positive iwewe usina infection, which means it becomes a very difficult test to interpret, number one. Number two, the whole issue of COVID-19 inyaya yetime kuti tikasike kudiagnosa munhu ane chirwere kuti akasike kubatsirwa, which means kuti ukaitwa rapid test yokuti uri negative iwe uri positive, we are going to lose time. Number one, we are going to lose time because we would think kuti uri negative yet you have infection. Number two, the infection can spread from one person to the other. So this test will tell you that you are negative, yet in reality you are positive. They can then have a false sense of security and then start getting into contact newe vachifunga kuti munhu ari negative yet iye ari positive, and in the process more people get infected. Saka ndiri kuti hama dzangu, as far as practically possible, everybody who is going to ask us about COVID testing, munhu wese achada testing, please ndapota, the best test is a PCR test. I know people are advertising rapid test. I know the rapid test is cheaper, but in the long run, it may actually not be cheaper because results are still accurate, and so we discourage it as far as possible. So panyaya diagnosis of COVID-19, mandinzwa here.
Kunzwa ichiremba.
Mandinzwa ka? Good. PCR test is the way to go. Good. So COVID-19, the challenge at Taita Manji, this is an infectious disease. What do we mean? It's transmitted from one person to the next. That's why it has been able to spread across the whole globe. That's why it has become a challenge globally, because the infection is spread from one person to the other. So for us to be able to control the spread of COVID-19, tiite kuti vanhu vakawanda vasabatire chirwere ichi, zvakakosha kuti tinzwisise kuti chirwere ichi chinospreada from one person say. So the most important way this disease spread from one person to the other is through respiratory droplets and contact routes. So what do we mean respiratory droplets? Kana ndichifema zvezvi, zvikuru sei ndikakosora kana ndikahetsura. Pandinokosora nekuhetsura, pane mvura dzinobuda either mukanwa kana kuti mumhino. Those droplets, if kana ndine chirwere che-COVID-19, those droplets contain the virus. So if these droplets akandodonera pa the next person, and these droplets kazhinji, they are able to travel a distance up to 1 meter. So kana uri padhuze neni ne 1 meter, ini ndokosora, and then mvura yemukamwa kana kuti mvura yemumhino, even kungotaura chaiko, pandiri kutaura izvozvi, pandiri kutaura ndiri ndega, so ndikazotarisa computer yangu ndinoona kuti yazara tumate turipo. It means pananga ndichitaura ndanga ndichibudisa tumate itwotwo tunenge tune virus rakawanda. Saka kana mumwe munhu ari pedyo neni manje, virus iroro rikasvika pamuromo wake, pamhino kana kuti pamaziso, this is how we transmit virus to the next person. So essentially, the virus is transmitted through respiratory droplets when we are close to each other, and then those droplets carry the virus from one person to the other. Kechipiri, if inini ndikazvihetsurira maoko, it means maoko mangu mane mate kana ma droplets ane virus. If I then touch, ndikabata a surface, ngatiti ndabata benji kana kuti ndabata table, that virus is able to survive on that surface for a couple of hours. Umwe munhu akauya akabata ipapo, it means mumaoko make mane virus awo. and akazotora ruoko rwake akabatisa mhino, akabatisa maziso, akabatisa muromo, it means now they are now transmitting. So it's now contact is now indirectly from one person to a surface, from that surface to somebody's hands, from somebody's hands to somebody's nose or somebody's mouth or somebody's eyes. This is how the virus spread. So later on in the course, when we then discuss how we should minimize spread of the virus, it then becomes very important to intervene, say, panyaya kuti how do we make our mouths, our eyes, our nose safe, and how do we make sure kuti handisipa distance iri within a meter from somebody kuitira kuti munhu akataura mate ake akazosvika pandiri ndinokwanisa kuzobatirira chirwere. Then people have spoken about airborne transmission. Airborne transmission mubvunzo ndeyekuti kana ndichitaura zvinoita here kuti virus rinobva rangopinda muair iri around me and remains suspended in that air for some time. Umwe munhu akazopindawo murumu mandiri osvika obva afema that air obva awana virus. And the evidence is saying outside the health setting, this is very unlikely. So the airborne transmission zvinongoitika chete muma health setting nekuti we are doing a lot of procedures nema patients, but for most of us who are in the community, transmission is essentially through respiratory droplets, essentially through contact one to the other. Mandinzwisisa. Thank you. We'll come to questions. I'm trying to be a teacher here, and Uncle Jeff is just getting an anointing here with the Sunday school, so don't worry. Good. Saka tinoziva sei manje, or what makes us suspect kuti ngana anenge ane COVID-19? Zvakawanda zvinokwanisa kuitika kune munhu awana COVID-19. But what is important is to realize kuti ndikabatira COVID-19 nhasi hazvirevi kuti mangwana ndinenge ndakutorwara. So it may take up to 5 to 6 days from being infected to start showing symptoms. However, in some people, it may take even up to 2 weeks. So what am I saying? Not having symptoms does not definitely say handina COVID-19. Because ndinokwanisa kuva ndine COVID-19 asi handisati ndatanga kurwara. And it is also possible kuti kune vamwe vanhu vanowana COVID-19 and my symptoms ake kana kuti urwere hwake huri so mild that they may actually never realize kuti ndaita chirwere cheCOVID-19. And these people may actually never get tested for COVID-19. So they may actually never know kuti vaita COVID-19, but anayo, which means kuti kana achitaura, kana achikosora, kana achiita sei respiratory droplets ake anenge ane COVID-19, but iye haasi kuzviziva. This is why people are saying, you know what, especially vana can get this condition and it can remain very mild. Oenda kumba kune vanhu vakuru, ondopa vanhu vakuru chirwere ichocho, and because vanhu vakuru, they are likely to get more severe symptoms, and then vanhu vakuru vozotanga kurwara, and everybody is like, no, but sekuru avanomubvira vabuda pamba zvambofamba sei, anokwanisa akaikirwa nemwana, but mwana never showed those symptoms because mwana was very what? Because mwana anga ane very mild symptoms. Sorry, let me just continue. My computer is stuck. Guys, are you following me?
Yes, we are. Yes.
It's interesting.
Good. So we're talking about signs and symptoms. So I want to emphasize that COVID-19, SARS-CoV-2 affects people of all ages. So munhu wese from vana veku Sunday school kusvika kuna mbuya nasekuru, they are at risk of getting COVID-19. But what then happens is kune a group of people yatoziva kuti ava, if they get COVID-19, they are likely to get very mild illness. Ava, if they get COVID-19, they are likely to get severe illness. So it is important for us who are on this call, who become like COVID-19 champions in our various assemblies, to be able to identify this one, akawana COVID-19, we must keep a very close eye on them because they are likely to develop severe illness. This one, yeah, they are likely to get mild illness. So generally, vana, they are likely to get mild illness. Having said that, we still get reports of COVID-19. It's unlikely to happen, but it has happened. Especially the elderly, those above 40, 50, as the age increases, the more likely you are to suffer severe illness. And also, so people with pre-existing conditions are further more likely to suffer severe illness. So what are these pre-existing conditions? Munagara ne problem ye asthma. They are more likely to get a severe COVID-19. Munagara ne chiwere diabetes mellitus, especially kana sugar. Diabetes mellitus is sugar, especially kana sugar is well controlled. So having said that, can I just encourage us, for our congregants, for our family members, for our neighbors, if you know anybody who is diabetic, please just make sure their diabetes is well controlled. Because if their diabetes is not well controlled, if they get COVID-19, they are more likely to suffer severe illness. Then people with heart disease, these ones, they are more likely to become severely ill. And then the question is, what about HIV? So far, what the evidence is showing us, HIV, ARVs ake zvakanaka, viral load yake iri suppressed zvakanaka, CD4 count yake yakanaka. We don't expect them to suffer more severe illness than the general population. However, for those that are immunosuppressed, that are not whose HIV is not well controlled, there is also a risk that they may suffer severe illness. So this picture is just showing you my symptoms, my signs and symptoms of COVID-19 akawanda, and they can be non-specific. So somebody can then just start having as a headache. What's important is, I think the key message mumwaka uno we COVID-19, when you develop symptoms or munakatanga kurwara, don't trivialize, don't worry, man, ungori musoro uchapera, don't worry, kangori ka fever kachapera. As far as is possible, seek attention early. Zviri nani kuzonza, no machka henyu but muri right, pane kuti makanonokwa. So because most of these symptoms are not specific and they are just general. So you can develop a headache. But who knows, maybe this headache is COVID. Or you may develop muscle pain. Kungotanga kurwadziwa nyama dzako dzinongotanga kurwadza, makumbo ari kurwadza, mabendekete ari kurwadza, mutsipa uri kurwadza, musana uri kurwadza. You must start asking yourself, could this be COVID? Or you can develop a fever kukwira temperature. But by kukwira temperature, let me emphasize. So I know tikapinda masupermarket, tikapinda pachi, everybody is checking our temperature. Temperature iri right. Kuva ne temperature iri right does not mean hauna COVID. Because it is possible to have COVID when your temperature is normal. So sometimes people think temperature yangu iri right, saka andina COVID. No, I remember I told you the majority of people will have mild illness. So you can actually have COVID and have a temperature at 36.5. You can have breathing difficulties. You can sneeze, kuhetsura. So essentially, my symptoms of COVID akawanda. But the most common are the fever, dry cough, and tiredness. So tiredness, so why are we telling you this? So that when these things happen to you, or somebody phones you and says, you know what, think COVID, funga COVID and look for help. No, because tagara tinongoita flu anyway. COVID or no COVID, tagara vantu tinongoita flu. But chanisuru ndechekuti tifunge kuti iflu iyo iri COVID. What about other less common symptoms? There are aches and pains. You can have sore throat. Some people will develop a diarrhea. Kutita manyoka chayo iyo iri COVID. Conjunctivitis, maziso anotsvuka, headache, loss of smell, kutadza kunhuhwidza zvinhu, loss of taste. I know one of my workmates recently suffered from COVID. Achiremba izvo zvichinja ndingokwanisa kudya sadza nederere. Zvimwe zvese I can't even taste. Zvekuti chicken, I've lost all taste. So when somebody reports these symptoms, think COVID. Better uzoudzwe nachiremba kuti no mhanya haisi COVID pane kuti wewe ungofunge kuti haisi COVID. Then what about serious symptoms of COVID? If somebody is having difficulties in breathing or arikupera mweya, arikutambudza pakufema, that's serious. So I don't want us to say no vari kumbotadza kufema asi zviri nani, then toti no regai tinamate tozoona kuti mangwana kunomuka kwakaita sei. No. When somebody is saying they're struggling to breathe, vari kupererwa nemweya, we can't say tozoona mangwana kuti anomuka akaita sei, because this is urgent, this is serious. Let's seek for attention. Chest pains, chipfuva changu chiri kurwadza, ndiri kunzwa senge munhu ari kutsikirirwa pachipfuva. This is serious symptom. Let's seek attention. Loss of speech or movement, kuti ndakutadza kufamba, ndakugara, ndakutadza kusimuka. Yeah, I mean this is serious illness. Tiri vanhu vekutenda, tinonamata, but tosimuka, tomhanya kuchipatara. When it's serious, let's run to seek medical attention. Good. Tichiri tese.
Yes.
Yes, we are following.
Thank you so much.
Yes, I'm with you.
So it's just, so we only have ladies on the platform, right? Right. Thank you. Let me just continue. I'll be done in the next 5 minutes. I see there are lots of questions. Please keep questions coming in so that we can have a healthy discussion at the end. So I have just
chiremba kuti vanhu vazoita counseling vati madzimai anotaurisa vazondona for
all right.
Sorry, doctor.
Great. So what have I been talking about? So far, Vadikani, I have defined kuti COVID chi, tikawirirana kuti infection, COVID-19 disease, urwere unokozerwa neSARS-CoV-2, tikadiscussa kuti inotapurirwa sei, tikataura kuti chikuru, it's about respiratory droplets getting from one person to the other. Tikataura zvekuti these respiratory droplets akaenda pasurface umwe anouya achibatawo, akabata akazoendesa pamuromo kana kuti pamhino, they get infection. Tikatsanangura about testing, tikawirirana kuti the best test is PCR. Rapid test, essentially my rapid test, they are used by governments and national programs for surveillance purposes. Kungoona kuti mudunhu redu kana kuti munyika medu uwandu hweCovid kana kuti vanhu vakambowana COVID hwakawanda sei. That is the major purpose here, rapid test. Saka tikawirirana the best test is a PCR test. PCR test iriko kuzvipatara zvehurumende, rapid response team, kuma private labs, Wilkins, in these various cities that we are at, rapid test is being done. Tikazodiscussa ma-symptoms nema-signs kuti unoona sei kuti munhu ane COVID. Tikatsanangura kuti ma-symptoms akawanda, they may be non-specific, so we need the most important things to mumwaka watiri kurarama. Ukata munhu akangotanga kurwara zvausiri kunzwisisa, at the back of your mind, think COVID. Tikataura zvekuti everybody is at risk of COVID infection, but tikatsanangura kuti kune vanhu vanokwanisa kuita a mild infection, kune vanhu vanokwanisa kuita a severe infection. Tikatsanangura kuti vanhu vechikuru, they are more likely to get severe infection, so we must guard them jealously. Tikataurazve kuti vanhu vari diabetics, katikati kumakereke kwedu, kudzimhuri, kuma-community, let's make sure kuti vanhu vese vari diabetic, sugar yavo iri well controlled. Vanhu vari hypertensive, let's make sure BP dzavo dziri well controlled. Kuitira kuti vakasangana nedenda reCOVID, they are less likely to develop severe symptoms. Tikazotaurazve kuti ma-serious symptoms, shortness of breath, zvikaitika, hazvina basa kuti it's 2 a.m. munhu ngaamuke amhanye kuchipatara. Chest pains, kunzwa kutsikirirwa chest, hazvina basa kuti it's 3 a.m. munhu ngaamuke amhanye kuchipatara. Tikataura loss of speech and movement. Great. So in conclusion, let's look at where we are in terms of this global, what's happening. So before we go global, let's look at Zimbabwe. So these statistics are as of yesterday. I think the most important thing is the figures up, they just give us an indication. They are not a true representation of what's happening in the community. Because for every positive test, there could easily be 10 people out there who have not been tested. So when we say there are 4,000 confirmed COVID cases in this country, I don't want you to go around thinking, Zimbabwe ain't got 4,000 yet. No. No one got tested for 4,000. But we know Vakawanda got COVID and never got tested. So which means the true figure is your guess or my guess. It could be 10,000, it could be 15,000, but what it just tells us is that denda reCOVID munyika medu rapararira. That's why we are now at 4,000. Kana tichiti recovered, essentially kudhara WHO would insist that we would only say munhu recover from COVID kana azoitwa imwe futi PCR test mbiri dzaita negative. But now things have changed, so we are saying that when you test positive for COVID, if after 10 days you no longer have signs and symptoms, you have recovered. And so far we have recorded 80 deaths. This was as of yesterday or the day before, so we are a bit behind. But these are confirmed COVID deaths. But we also know that there are a lot of deaths that are occurring in the community, which could be due to COVID and never get diagnosed as COVID. So these statistics, essentially, they just tell us, you know what, COVID, yes, worldwide, yeah, it's now over 18 million. Deaths are now at 692, almost 700,000 deaths. So yeah, like we said at the beginning, this has really been a major global health crisis of our time. But if we look at closely at Zimbabwe, so this was in the Herald, I think yesterday, you then look at which areas are now like the hotspots. So Harare alone has got the biggest burden of COVID-19 in our country. 1,584 confirmed cases, which means the cases in Harare are way, way, way more. What this means is that because COVID is now all over in our country and because the cases are now community transmitted, zvekudhara zvekubvunza munhu tino mambobva kuSouth Africa here, mambobva kuEngland here, hazvisina basa because vanhu vakuwana COVID community. What this means is, kana inini ndichitaura namufundisi wangu Marwisa, hazvina basa kuti mufundisi wangu, hazvina basa kuti tinonamata tese. As long as I don't know his COVID status, he is COVID positive and potentially he can transmit COVID to me. Ndopa zvasvika izvezvi kuti anybody or anyone could be COVID positive because COVID yapararira nyika yese. So we don't want a situation yekuti hanoti hairdresser wangu ndinoyasa munzwisisa. No, hauna kurara kumba kwake. Wanga wasimo paakwira kombi kuya kubasa, muzumbuko raakwira wanga wasimo. So hazvina basa kuti tiri meeting intercession, hazvina basa kuti tasangana kuti tinamatire nyika against COVID. Ivava vanhu vamuri kunamatira nyika navo against COVID, one of you could actually have COVID and transmit to the other. So I think the statistics in the country are just showing us kuti COVID yatekeshera nyika yese and anybody. Yes, Harare and Bulawayo are the hotspots, but perhaps it's because that's where testing is happening. I'm just thinking, kumusha kwangu kunyanga, people may not be testing that much. So we may then think, COVID yakazara Harare. It may just be a function ekuti people in Harare have got better access to testing. What about somebody in Churumanzu? They may have COVID and not have testing. Great. Amadzangu, let's now discuss. I think the Taura Shakawanda, we